what you're doing is you're stabilizing from above, and then the mobilization itself is through the cephalad hand, which is the lower arm, hooking and almost pulling them forward this way. Right rotation, because we named top on bottom. So you could do this two ways. You can stabilize from above. Okay, so if I'm going to use this arm, if I'm going to use my inferior arm, can we say inferior, superior? If I'm going to use my inferior arm to do the mobilization, I can pull him forward this way. Okay, and then what I'm doing here is I'm stabilizing the spinous process above with this hand and getting right rotation. Okay, the other way that they're saying is you can stabilize from below and try to push through from above. And so now what I'm doing is the same thing. It's still right rotation, except now I'm moving T5 on T6, where before I was moving T6 on T5. If my left arm's doing the work, or it's pulling him towards me, which is making this spinous process, right, this is the way they're sticking out, it's going like this. Now what's the top one in relation to the left one? It is actually rotated to the right. So the rule of the lower finger says, the lower finger, if the lower finger's on the left, which way am I rotating the person? To the left. So I find the transverse process above. I find the transverse process below on the opposite side. And then I'm going to use my hypothenar side of my hand to impart that posterior to anterior force. It could be an oscillation. It could be a grade 3 mobilization hold. This is left rotation because my finger on his left side is the lower of the two. Pulling this forward, which way is the top moving relative to the bottom? Left. Left. It's left rotation no matter what. And it's always named for the way the person's laying down. Whichever side is up, that's going to be the direction you go. So if you're ever asked, you know, what position does the person need to be in to perform right rotation, you would have to say, well, they'd have to be side lying this way, so the right side is up. So if I'm going to do top on bottom, what I want to really concentrate on is this index finger, or maybe even both fingers, trying to get underneath the spinous process below. And then this one, pincer gripping over the top and using my thumb and my forearm as that force to get that rotation from above, while this bottom hand is just stopping it from moving. Conversely, it's the exact same position, except if I want to move bottom on top, I pull the bottom towards me, and I just keep the top right where it is still.
Spinous process for both.
The spinous process is for both. And there, you'll no matter which one I move, this way or that way, the same rotations happen. The technique from before is the intervention. So this is the rib PA technique from the side. So he's doing the lower ribs, okay? One important consideration, whether you're doing the mobility assessment or the treatment, is you should always stand on the side opposite, okay? CL, contralateral. Stand on the contralateral side of the rib you want to mobilize. Same thing for the assessment, okay? If I'm assessing the left ribs, I want to be on the person's right side. I'm going to stabilize the thoracic spine with this hand, and my superior hand's the one that's doing the technique, okay? It's the same thing here, okay? He's standing on this side, standing on the patient's right-hand side, so he's mobilizing this way. So his superior hand, his right hand, is on the rib that's doing the work. That's the rib that we're working on. And the left hand, his lower hand, is stabilizing. That's exactly what that picture's showing you. Now this is a grade 1-2 oscillation. It could be a grade 3 mobilization. Take it to grade 3 and hold. Or later on, after we teach you thrust, you can convert this and just do a PA high velocity thrust. I can be standing from this side again, this hand coming across because I need that, and then from underneath there. And I can do grade 1-2s. I could make it a thrust technique if I want to, okay, from above. As the assessment, just like before, except now what you'll notice is instead of the fingers being in between the spaces to assess for how much motion's going on, he's stabilizing the rib. Okay, so if I decided I want to mobilize rib 2 on rib 3, with this hand I'm stabilizing the rib, And then with the other hand, I'm just pulling into that bucket handle, pump handle. I'm flexing that arm, and that's where I'm getting the mobilization technique, okay? And it might even be better to stand this way.
You stabilize the lower rib.
You stabilize the lower rib. I prevent the lower rib from moving, so then when I'm pulling on the arm, the upper rib fingers be in between, trying to feel how much it's moving. I'm going to stabilize the rib, the lower rib, and pull with the arm to get that rib separation. And then it could be an oscillatory, but generally speaking, you might want to just work on stretching that. If you notice that that was hypomobile, there might be soft tissue restrictions going on between those two ribs. Stretch those out and try to lengthen that collagen as much as you can.